Hi everybody, this is Dr. Eliana Aaron, Director of EMA Care. I hope everyone is taking good care of themselves. I want to talk about the overall situation, how we got into this mess, lessons we can learn from other countries, and trying to figure out, first of all, how to prevent this from happening in other countries, because we are seeing upticks in other countries, and also lessons that we can learn from this overall. So in addition to that, I'm going to talk a little bit about some of the riots that have been going on and some of the false information that seems to be spreading in the population in Israel, and how to answer that, because it's very tricky. So I'm going to start off with, how did we get into this mess? When this started, there was a lot of criticism about people who were being lax about the rules. And this is a problem that's known as fatigue. We all know what fatigue is. Fatigue is when we get tired and we get sleepy. But fatigue, when it comes to epidemiology, is that people get tired of restrictions. It's pretty simple. You know, wearing a mask, locked up in my house for a couple months, get me out of here, I don't care what it is. And we saw this happening with lots of parents who were taking care of all their children at home. The children were losing it, the mothers were losing it, the fathers were losing it, everyone's at home, no one could function. You can't work from home when your kids are screaming and need help, when you're making food continuously, cleaning continuously, homeschooling continuously, and people were kind of losing it. So when restrictions started being lifted, people really, and it's understandable psychologically, said, woohoo, I'm done. I'm so done with this. And they were fed up. What it led to, of course, which we all know, is a real dangerous relaxation of the regulations. But part of the problem was not just the people. Part of the problem was that there were governmental problems going on at the same time, and we were not getting clear messages. So this is not exclusively a problem of people didn't wear their masks. This is a bigger problem, and it's a systemic problem. And we're actually starting to see this in other countries also, so there is something to be learned from this. So first of all, it's important to note that when it comes to government policy, the first lockdown we had was pretty easy to implement for the government. I mean, it wasn't easy and it wasn't cheap, but the government didn't have a functional structure. We were in between elections. We did not have a proper government. We had no budget. We still have no budget, actually, but we basically had Prime Minister Netanyahu. We had a lame duck government that was about to be voted out again. And there wasn't really anyone that was going to come in and be able to press in their special interests or what their needs were, other than the few people who were in the leftover government from the previous failed election. So that means there was no resistance. I mean, if you say we're on a lockdown, we're staying locked down for 2 weeks, then that's what we were. You know, the government, or you could say the Prime Minister, got his advice from a select group of people, some in the Ministry of Health, some in other ministries, and that was it. That was the whole thing, and we were done. At the time, we had a different Minister of Defense. It was Naftali Bennett, and he was able to mobilize the army to help with some of the quarantine issues and to provide certain kinds of support. There wasn't any resistance, there wasn't any voting, there was nothing, because there was no government. And as much as that's not terribly democratic, it's what we had, and it worked. I mean, we actually, the first wave we did very well. We were voted the safest country in the world. You know, we were on everyone's green list. How did we get just a month and a half, 6 weeks later, we got to everyone's red list? So now we are red listed with our second wave. So what happened is that the government made a few key errors. Number one is they did not continue to justify the need to continue with the regulations. When you give someone something to do, but you don't include them in the decision making, you don't provide them with the evidence, you don't provide them with the reinforcement, And then it seems almost random how you're opening up the country. We opened up the country in a haphazard way. Now, when you open up the restrictions and there's an active virus going on, and we all knew there was an active virus going on, there isn't enough time to measure the consequences of your actions. So we were all very confused because the government said at first, we're going to open up measure for measure the way we shut down, just slowly measuring one thing at a time, make sure it's working. Sounded very organized to all of us. And some countries are successfully doing that to great benefit to them. And I'm going to talk about that because Norway is doing that and they're doing a fantastic job so far. But what we did is we got an announcement, okay, today we're going to allow 50 people to get together. But we're not going to do anything else until we see everyone's keeping our restrictions and everything. So we thought, okay, fine. 2 days later, 3 days later, we're up to 250 people. And we're opening this and we're opening that. And even as the numbers were creeping up, we kept hearing announcements, we're going to shut things down and we're going to shut things down. And by the way, we're reopening this and we're reopening that. And there were no new restrictions, which means we were really getting mixed messages. And frankly, people stopped believing the government. The government said, we're going to do this and we're going to do that. And they couldn't decide anything except to reopen the economy. Now, reopening the economy is a very intelligent thing to do. No country, no people can live without being able to make money, being able to function, being able to go to work, being able to send your kids to school. This is a very logical thing. Nobody wants to keep the economy closed, but everything has to be done in a measured way when you're in the middle of a global pandemic. And the long-term consequences of not being able to do that is going to be very significant for Israel. For example, had Israel done what Norway did, and Norway is doing, which is actually following the original plans that we had, which is that we reopen slowly, one level at a time in the different areas of the economy. And then we pause and we measure, and we have our scientists out there and epidemiologists out there figuring out, are we actually getting coronavirus in pools, in pubs, in gyms, in weddings? What can be done to tweak that? Before we start with weddings of 250, let's look at weddings of 50. Are weddings of 50 spreading coronavirus? Are weddings of 100 spreading coronavirus? So instead of jumping from 50 to 250, this would have been a more measured approach. Now, what does that mean? That means all the people who run wedding halls would say, no, we can't do weddings for 50. We have to have 250. That's our minimum. 50 to 250 is a huge jump. It goes from a mostly immediate family group to a nice sized wedding. In Israel, 250 people is not a large wedding, but it's certainly a fair sized wedding. And just like that, it jumped from one to the other, 5 times the number of people. And once you invite people at that number, at 250, you're talking about inviting people from all over the country to gather together. So it's a big jump, and the pressure that the government felt led them to make poor decisions that did not seem to have any rationale. So telling people, you could go to a wedding for 250 people, but you still have to only have 20 people in synagogue. That didn't make sense logically, and we all knew that didn't make sense, because a wedding where people are holding hands and dancing and breathing all over, and let's be real, not too many people are wearing masks in weddings. It didn't make sense that all of a sudden that was the weddings, and then here was the synagogues. So something was off there, and we all started realizing it. And we didn't understand the data, and even to this day, we don't understand the data. Last week, the gyms got closed, the bars got closed, the pools got closed. This week, the bars and the pools opened up because they couldn't really show too many cases that people got from those 2 locations. Okay. How many cases did people get in bars? maybe 30, 35. I wrote it down yesterday in the notes. But that's not the point. The point is you have to be able to justify your data. So instead of investing in opening up all the different areas slowly, so everyone can have a little piece of the pie slowly, measuring it. What they do in Norway, they open up across the board. And the hotels are open like this and the bars are open like this. And each area of the economy has representatives that talk about what their needs are so that they can build a program, and they help to build it themselves so that they could each open up slowly. And then the government comes in and says, okay, we're going to tell our public what our plan is for this stage and how we're going to measure the outcomes. You can't measure outcomes in 3 days. You can see that from our delayed critical cases graph. It's 2 to 4 weeks before you can even see the real upticks of critical cases. So what Norway has done is Norway has basically monitored 2 weeks later, and then between 2 and 4 weeks, they continue monitoring and tweaking. So if they see there's an uptick over here, they say, well, you know, we need to screen people better when they get into, they need to screen people better when they get into, let's say, gyms, or they go to restaurants, or whatever it is. So they tweak, they explain to the public on a regular basis the scientific justification for telling people to socially distance. So for telling people we can't have bars that have more than this number of people in it, because as soon as we got to this number of people, we started having more cases. And here's some things we're going to do to try to get us up to that level again. We're going to do this intervention and that intervention. And only after they do that do they open the next stage. And that measured response means that they did not jump from weddings of 50 to weddings of 250, but it means that 2 months later, their economy is still doing well and ours is not anymore. They have tourism already. We don't. We're not going to anytime soon. So had we been able to actually open up in a scientifically clear way, with good communication to the public, with a clear understanding and logic and plan. It seemed like we had no plan in this country. It was whoever fetched the most to the prime minister, they got what they needed. That's what it seemed like. It was completely irrational. And we all saw this happening as it unrolled. And what resulted is as we like to say in Israel, the balagan that we're in now. And the balagan is not just the balagan. It's a balagan that's going to cost us lives. It's going to cost us in our economy. Our tourism industry is destroyed for this year. It's completely destroyed. And you're talking about a huge percentage of the GDP of the country gone because of the second wave that we had to jump and listen to everybody without a controlled plan. Governments need to open up in a controlled way, which is scientifically just, which is explaining to the people why they still have to wear masks, explaining to the people why there are limitations, why we don't want this and we do want that, why it's okay to go to the beach, but it's not okay to go to the pool. I mean, we don't know that, but I'm just saying, people need to understand why they're doing it. They need to understand it. And you're not going to get compliance from the people until you are able to do that. When we had the first wave, the prime minister spoke to us every single day. Now, whether that was necessary or not is a different question, but we felt like, okay, we are part of the team. He's explaining to us what's going on. Sometimes it was kind of repetitive, but the fact that we understood it and it was logical to us at the time meant that there was a very high level of support for this. I'm going to go now and talk about some of the other things that are going on in this country, such as riots and protests. Well, there are protests that turn into riots. So in the history of pandemics around the world, you'll find that social unrest is part and parcel of a pandemic. And so it was not surprising to me that the riots that are going on in America coincided. And it's not just riots, it's real social unrest and anarchy is very much associated with pandemics. And this is a historical fact. It's part of the consequences of being in a situation of prolonged illness, prolonged lockdown, and prolonged fear. People come out, they lash out, and it could result in anarchy and governmental change. What's going on in Israel, though, is interesting because there are riots, and sometimes the riots are becoming violent. In the case of the two protests that happened over the weekend, you had the anti-regulation people who said, leave us alone, open everything up, we don't care. Those were the Tel Aviv people, mostly very young people. They want their pubs open, they want to go to the gym, they want to go to the pool, they want to go to the beach, they don't want restrictions, they don't want to wear masks, they don't want to socially distance. They're done with all that because, frankly, they're not the ones in the ICU with a ventilator down their throat, and they are not the ones who are going to die. Unfortunately, also, a lot of the times those people end up becoming the super spreaders. Those people end up becoming the people who get a lot of other people sick in that age range of, let's say, 20 to 40, young people. Part of that protest became violent and a bunch of people were arrested. So there's a lot of built up anger and frustration about this, again, unknown rationale behind what seems like random closures and random restrictions. So a definite publicity change has to happen here to prevent that from happening. The flip side of that is something very interesting, which is the Charadi, or ultra-Orthodox, protest that happened in Jerusalem. The Haredim believe that they are being discriminated against. They believe that they are being isolated, that they are being treated differently than the other parts of the population, that the Arabs are not locked down, that Ra'anana is not locked down. These are quotes from their protest, and they are being locked down. And the fact is that the Haredi populations in Israel are being targeted, but not because of discrimination, but because the ultra-Orthodox neighborhoods are also the poor neighborhoods in Israel. They are the neighborhoods where people have a lot of children. They have an average of 7 children per household, and they live in very close quarters. In these close quarters, they cannot physically quarantine. The government's able to tell that this is going on, that people are getting sick and not quarantining properly, when 68% of the population in these neighborhoods that are getting new cases are family members of people who are sick. So if, God forbid, I had someone in my family who was sick, I would put them in a room appropriate for a quarantine with their own bathroom. They would be isolated from the family until they were healed, until they were well, okay? If I live in a poor neighborhood and I have 1 bathroom for the whole family and I have 2 bedrooms for the whole family of 7 children and 2 adults, so the kids are also in the living room, there's no place for me to put that person in my family. There's no place for me to isolate them. We're going to isolate everyone together. So everyone's going to end up getting it. So instead of 1 person having it, now you have, let's say, 9 people having it. Or statistically speaking, really 6 people having it, because not everybody gets it. We don't know why. So what this means is that there's a lot of misinformation and a lack of communication with the Haredi population. This happens a lot, and it's terrible. They do not read the newspaper. They do not see the internet. They do not know that the Arabs were in Rahat and Arara were under quarantine and lockdown for weeks, well before any Haredi populations in this second wave were under lockdown, because those are also poor neighborhoods and they also couldn't quarantine properly. So the government came in and locked down these neighborhoods and provided people with services so that they can get well. And their numbers are looking very well now. It worked. And in the first wave, when they locked down the Charadi areas, it worked. The Haredim were disproportionately affected by the first wave, and they are starting to be disproportionately affected by the second wave for the same reason. And if you look around the world, the Orthodox populations in the world were disproportionately affected by coronavirus. They had almost 10 times the number of deaths of the regular population, 10 times the number of cases of the regular population. So it's a combination of socioeconomic issues, a combination of religious issues of people davening together in holidays where you go to synagogue, where you get together with families. But in all cases, the information that they believe is true is not actually true. Why? They ask, Ra'anana had all of these cases with these illegal parties. Why isn't Ra'anana locked down? Ra'anana on the socioeconomic scale is a much higher level than Bnei Brak or areas of Jerusalem. Ra'anana is a rich city. Most people in Ra'anana have at least one ensuite bedroom. That means that they have a place for their teenage daughter who was in an illegal party, who now has coronavirus. They have a place for her to quarantine at home. And if you look at the statistical numbers, there was a big jump in Ra'anana. They got a few hundred cases, okay? And then it stopped. The new cases per day trickled down to 15, 10. So there was a bump, people went into quarantine, and it stopped. When you look at places like Jerusalem, Bnei Brak, Beitar Illit, Modi'in Illit, what you're seeing is the numbers are going up, and most of those are spreading within families. So we do know from the study that was released, but we also know from other studies that were released in America and other countries, socioeconomic living conditions are very much part of the picture of who is at risk for dying, who is at risk for getting complications from coronavirus. And bottom line is, we know you can't quarantine. So unless you are one of the few people in these neighborhoods who have very large apartments and have lots of bathrooms and are able to quarantine, the reason why the Haredim are being locked down is because they are poor. They cannot follow the regulations to keep their families safe. They are protesting the yeshivas closing down. Well, in Tel Aviv, they're protesting the gyms closing down. And by the way, when the gyms started closing down, some gyms started talking about converting themselves to a Torah learning program so they could be called yeshivas because some of the yeshivas were open. So you need to realize that there's a lot of misinformation. Now, in some countries, in Africa, for example, and in Thailand, there are community workers, part of those communities. These are not highly educated people. These are people from the community who have a brief education, but have the ability to go into the communities and to be able to talk to people about what needs to happen and you know, to wear the mask, to socially distance, how to wash their hands properly. That may be a solution for helping to communicate with the Haredi populations. The rabbis have to be leaders. They have to get involved. They have to tell their community what to do. Throwing rocks and eggs and hitting police officers is not a solution, and it's a terrible thing to do. It's a chilul Hashem. So, you know, and I'm studying to be a volunteer police officer, so I take this very personally. I don't want to be on the other end of that. But what I do know is that there has to be more effort, like grassroots effort, to communicate, because right now the Haredim who don't have access to media really are under significant misimpressions and misinformation, and their leadership is not doing anything to stop it. The police, in the meantime, are going around calling out in Yiddish instructions. The police are walking, there's a video, a very nice video of the police walking around Geula, which is a Haredi neighborhood in Jerusalem, handing masks out to people who don't have them. Instead of giving tickets out, they're handing masks out. Please use a mask. Positive messages are helpful. Unfortunately, tickets are also helpful. So there have to be a balance between these things. Building up trust is important, but I do think that Israel needs to do better to get a better image and to get better compliance. And that an overall looking at what we need to do and what other countries need to do is opening the economy in a slow but steady way. If we had started doing that in April, and we continue to do it in a controlled, measured way, we would be welcoming tourists now, and we would not be dealing with this second wave. Only by doing things in a measured way, with a scientific backing, with good communication to the public, to all the sectors of the public, especially the vulnerable sectors, are we going to be able to stop this from happening, to stop the continuation and proliferation of this disease, and to go back to normal. This is Dr. Eliana Aaron, Director of EMA Care. I wish everybody a safe and healthy week.